Healthcare is so important. People don't make decisions about work without looking at healthcare. And people with disabilities are much more dependent on good healthcare.
So access and having access to insurance that provides necessary clinical services is an important benefit that is necessary for persons with disabilities to be able to remain engaged in the workforce. And more often than not, people with disabilities choose not to get employed because they then can become eligible for public funded insurance programs. And resultingly, it causes them to be in the portion of the population that remains to be unemployed and out of the labor market. So access to health insurance from the perspective of person with disability is an important benefit.
If we let people work, then they will contribute back to the system. And so you have this cycle because you have people saying, well, you know, the 47%, we don't want handouts, whatever, the takers. But if you give the takers money, the takers spend money and become givers. They become part of society. So this concept is a little warped. If you put people with disabilities in a position where they can work and get health care and be treated like everyone else, they're going to work and be treated like everyone else and pay taxes like everyone else and contribute back to society.
We're at a very constructive time in history with the implementation of the Affordable Care Act and different models of obtaining health insurance rather than the predominant model of only employer-based health insurance. So as you may have heard from some of these other speakers and the conversations that we've had in the hallways, there's been a lot of activity about whether health insurance status will affect employability and particularly the ability and willingness of persons with disability to stay in a job. I guess we have enough research results that indicate that long tenure in a job is associated with lower health costs, better frame of mind, quality of life, etc. So employment really is a key. I think for all of us, we all feel better when we get a paycheck, but also we feel a sense of self-esteem and professionalism and career advancement in our own work.
So what my research looks at is to what extent the health insurance and having access to health insurance predicts the job turnover rates among persons with disabilities. And based on our analysis, we find that it has a major role to play in predicting the job change and turnover rates for persons with disabilities. And it is a crucial benefit package that is highly valued among employees who may have a disability. Now, in terms of its importance going further, is that with the Affordable Care Act and lots of its regulations being rolled out, it remains to be seen as to how the access to employer-paid health insurance changes over time. At the same time, how other changes in the insurance market impact people's decision for changing jobs or increasing their job tenures in their workplace.
The goal is everyone has health insurance. That changes how employers and employees start to think about what they need from their employers. So as we look at the data sets and we look across, and what Kevin talked about in his presentation on the compensation gap versus the wage gap, what people are really looking at, they may be looking at and valuing health care. But now that we have this new law, how is that going to change what people are valuing in the workplace? And how will that impact those with disabilities? What are they going to be looking for? Will it change how they go out and search for jobs?
People who don't have health care don't want to work because they get Medicaid and Medicare. And if they work and they don't get benefits, then they lose out. But if we can improve their health care and make sure that people are getting the health care that they need and the services that they need, then it's natural for them to want to work.